Welcome back to the Health Elevated podcast. Last time we talked about how insurance premiums and your overall expenses for healthcare are going up, and we kind of explored the reasons why that might be happening. One thing we didn't mention that is also part of the problem is changes to government, if you will. There's different, I understand that certain subsidies are running out, and we didn't even mention those, so it's a problem for all of us. But today we wanted to explore a little bit about how maybe AI could save you money on healthcare. So AI obviously is being used all over the place in all kinds of industries. People are losing their jobs because of it. And so the question is, can you actually use this to save yourself some money when it comes to healthcare expenses? And of course, as always, I'm joined by Dr. David Hedges, doctor of many things, doctor of biochemistry. But he's also a seasoned data scientist, so he knows a lot about AI, that is artificial intelligence. So, David, we were kind of talking about this earlier. Do you think AI is actually going to save money? There's a lot of investment going into it right now. What are your overall thoughts on AI?
Oh, my thoughts are really complicated about AI. I think I I really like it. I like its ability to, to create order and understanding out of a highly multivariable environment. But with that, the complexity and the mathematical complexity comes a lot of cost. A lot of, we're way beyond the age of simple solutions. I like simple solutions. Um, So yeah, but kind of to come to your question, I want to ask directly. I mean, do you think AI will save us money? If I look back at the history of technological innovation, I think that there's been a lot of various advances and innovations that have had the promise of saving money, have the promise of reducing workflow, but I don't know if that's been realized with anything. And if you look at like email, for example, email is supposed to save time, save effort because you can just contact people through the internet. But I think we get a lot more done. I think we all send a lot more messages, but we're all just as busy. Everything's just as expensive as it ever was. So do you think AI will save money?
Well, I kind of think that efficiency does count towards money. I think these companies are bringing in more money because their employees are able to do more with less. And, I saw this recent video that was talking about how kind of like I don't know, it was trying to make the case that the modern workday isn't even needed because back in the day, it did take 8 hours to do your job. And now with like some of these technological innovations, it doesn't actually take as long, but yet employers still expect you to work as long without paying you more. So everyone's gotten more efficient, but no one's really gotten more compensated for it. That's kind of the case it was making. I kind of think that's funny. So when you could think of it as like, I don't know, there's so much investment going on into AI that I think, I don't know, economically speaking, is going to bubble over, I think. And the ultimate gains that are going to come from it, I think there will be some money to be gained. And like, where is that money going to go? Is it going to go to the people? Is it just going to be businesses that are making more money? I'm not sure, but I do think overall it is something that saves time. I think time is money. There you have it. But one thing that we are interested in.
Well, let me
Oh,
challenge
go
that really
ahead.
quickly because
Yeah.
my guess is that at the end of the day, successful implementation of AI will just keep companies competitive with each other. And once one company really, gets those efficiency gains, everyone else has to, otherwise they'll be out of business. So I do worry about that is like the purpose of it will just be to maintain competitiveness in the market rather than to return savings or investment to either the people or the company or the executives. So I think
I mean,
that is a concern off the surface.
sure, sure. And one thing that we do want to talk about, you know, is the idea of how maybe you as an individual can potentially, maybe, benefit from AI in a way that helps you save money. We're talking about healthcare here, obviously, on Health Elevated podcast. And one time, so this is kind of what I was thinking about because last time you gave some insights onto like how people can maybe save money even though their premiums are going up. One of the things you talked about is emergency room utilization. And that reminded me of a story where my son had a little accident at home where he hit his head a little bit. Not like a head injury, but like a surface bleeding wound. And it's one of those wounds that we're like, okay, wait, like, does he need to get stitches? Like no concussion, he's fine there, pretty sure, but like nothing's open right now. Do we take him into the emergency room? Like it was hard for us to try and decide whether or not we should take him in. Now, ultimately, the decision is 100% ours, but we kind of consulted AI. Not kind of, we did consult AI, and it was like, okay, at what point does like a bleeding like owie? I'll use the word owie since we're talking about a little 3-year-old here. Like, does that need to go to the hospital and, like, get it stitched up? Like, can we like, one of the questions we had was, like, can we wait till tomorrow and still get it stitched? Or is this something that's, like, time of, like, urgent? Like, and so the AI was able to kind of, like, guide us through some of those questions. And I say guided it on purpose here because, again, I don't think you should rely on it to make decisions. You know, you're not gonna blame the AI and try
Well,
and sue it because,
I do wanna
um
bring that up as you're talking then. Like, a slight discomfort on my side is, like, AI is not a clinical professional, does not have the training, and we shouldn't rely on it for clinical or medical advice, and that if you are like, if you do believe that you're experiencing a medical emergency, you should not hesitate, you should just seek medical attention. I mean,
absolutely, yeah.
um, yeah. I mean, there's
Yeah,
times when, like, emergencies, I mean, stroke, I mean, minutes are of the
absolutely.
essence.
Yeah. And, you know, for some people who have no idea what's going on, which I think most people, hopefully, yeah, in fact, we have a podcast episode about how you can recognize the signs of stroke, for example. That's just one that comes to mind. But like, you know, it's something that can be used to supplement. But you know, you like if it's something that's dangerous, you call 911. That's what you do. You know, you know, oh, don't
Yeah,
get you.
absolutely.
So let me emphasize here that my son was fine. The question at hand was not like if he's gonna live or die. What we were wondering about was, is this gonna scar? Or should we have him go get stitched up? And, like, should we take him in tomorrow or should we take him now? And so my wife actually has some training, so she knows a lot more than I did, and, you know, I'm the one who's, like, pulling out the AI to help me in, this is basically clinical decision support, you know? You bring your knowledge to the table, you know the circumstances, but, you know, ultimately, you know, I learned a little bit about the urgency of maybe getting stitches versus not. I you know, and to me, I think it was a helpful decision aid support in that circumstance. Again, this wasn't an emergency, so like David said, call 911, go to the hospital if it's an emergency. But this is something that I think ultimately saved us money and turned out to be the right decision because we didn't end up going to the emergency room. And he didn't need to go to the emergency room, and using AI helped us get to there because we were kind of torn. We knew he was gonna be fine. He calmed down actually really quick, but it was just like, what like, is this gonna be something that
Hmm.
we're gonna regret going to the emergency room, or is it gonna be something we're gonna regret having not gone to the emergency room? 'Cause I gotta tell you, there's been times we've gone to urgent care emergency rooms where what they tell you is just, "Yeah, we already knew that." You know what I mean? And so part of my fear, I might maybe I'm alone in this, but, like, there's been times where we have talked to doctors or something, it's like, "Yeah, just rest and drink water." It's like, we were already doing that. So, you know, a lot of times, the body, you know, really heals itself, and doctors kinda help you get into an environment and manage the
Yeah.
pain, if there is any, to help your body heal itself. And so I was worried that we were gonna go in there and gonna be like, you know, waiting for hours and hours for them to be like, "No, it's already too late to do stitches, and he doesn't really need them." So, I was a little skeptical about going, in the first place. And at the end of the day, you know, AI really is just a feedback loop that, like, tells you what you wanna hear if you're especially if you're not careful. But it did provide, some reasons for that, and for that, I think that was a good thing. Anyway, I'm talking a lot. Your thoughts?
Yeah, well, so I mean, knowing how AI works, how it's developed, and I don't know the intricacies of the big models like Gemini or ChatGPT, but roughly knowing how it works, I I would be hesitant to use it for at home kind of clinical support. And I was thinking through that, like, I don't know if I would have used it the same way that you did. There's other things like we can get into later that I think are really good ways we can use it to improve our health and overall, decrease the cost of our healthcare over time. We can talk about that in a little bit. But I was thinking, like, why don't I use it for those kind of applications? Because I don't
Because you
want to
already
say
know
that
what you're
they're
doing,
they're
right?
good or bad. No, I don't know what I'm doing. And I think the reason is because um my brother, who I'm very close with, is a physician. And
Oh, you should call him then.
anytime anytime when I'm on the fence about something, I call him. And
Yeah.
he's been very generous with,
If
providing
I had a brother who's a physician,
information.
I would have maybe done that instead for sure.
Yeah, I don't know if I'm quite comfortable with asking AI if I should go in or not. I don't know if I would have done the same thing,
I
but I
mean, the
would
question
have
isn't
called
so
my
much should
brother.
I go in or not, because when you're talking to AI, you kind of have to be strategic. It's more of like, hey, generally speaking, what are because you're just it's similar to an internet search, it's like, hey, generally speaking, what are the signs that someone should like go
No,
in for
I
this and this?
see
So
what
it's
I
more
see
like
what you're saying.
diagnosis,
I completely see what you're
instead
saying.
of like make a decision for me. No, 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 no. It's more of
No,
like give
I'm
me
not
the
faulting you or trying to criticize you in any way. I'm just saying
no, yeah, yeah,
I don't think that I would have done that, and I think the reason is because I've always used my brother in that capacity.
yeah, yeah, yeah. Which
Yeah.
is great, which you should, because I think an actual doctor, would have been, I guess
Yeah, and I know that
I'm not that kind of
there's
doctor.
like there's also a lot of nurse hotlines you can use for those kind of applications for working with people, like, "Hey, like, I have this question, don't know if I should be coming in or not." Um, I know that those exist, and I think that that's a good opportunity for a lot of people.
Yeah, as opposed to the emergency room. But yeah, it is tough. I think the circumstance that gets tough when it comes to urgent care or emergency room utilization is when things happen outside of operating hours. The urgent cares aren't even open all the time either. And so
I
if it's
mean,
a
if it's
certain,
after hours and yeah, you
then
you need something, your options are limited. There's no
yeah,
question about that.
and that sucks. And then, but there is a financial burden, unfortunately. Like that does come into the equation. At least
It
for me,
does.
I'm thinking like, we're going to spend a lot of money to sit and wait and for them to probably not help us. And we know he's fine.
No, and I've
So
had the frustration of taking a kid into urgent care and a physician just saying, "Well, let's just wait and see
yeah,
if it hasn't
exactly.
cleared."
Yeah.
And it's just like that's really frustrating, and it doesn't make you want to seek any kind of medical care when you're worried, because you don't want to spend that kind of money if the doctor is just going to say, "Let's wait and see. Go home and drink some water."
Yeah.
That's poor quality of care. I'm sorry to say that, but that's we need better triage systems so you don't have to go into an urgent care to get that.
And one thing that we haven't really talked about enough right here. So let me ask you this because you seem, well, I mean, you have your brother who's a doctor, but what about when it comes to, let's say, months ahead of time, years ahead of time, preventative care and talking to AI about preventative care? What are your thoughts on
So
that?
I actually think that this is a really good application. And so when we're talking preventative care, I think we're talking about maintaining your health overall. Or we just would you agree with me on that?
Yeah, yeah. And like, yeah,
So
preventing,
I
you know,
am of the
expensive
opinion
diseases.
with a lot of my readings on public health, when I regularly read various pieces of scientific literature, etc., that um, molecular health of our bodies is what results in the physiologic health, and that ultimately, expression of health, how people look, etc. And so I think like if we can treat our molecular selves well and be healthy at the molecular level, we will probably be healthy overall. And as near as I can tell, with the hundreds of papers that I've read, the biggest themes to taking care of yourself on a molecular level are actually exercise. And I around you, you'll disagree with me here, but I would say both lifting, so strength exercises, and endurance or cardiovascular exercises are important.
Well, I agree with that. Why
Dare I
would I
say
not agree with
critically,
that?
because you don't like endurance exercises. You don't
I
like
just
cardio.
because I don't like them doesn't mean I don't think
But
they're
okay,
I
okay,
well,
fair.
yeah, I
Um,
would say, yeah, walking
yeah,
it would be walking, cardiovascular, and weightlifting, and probably
okay,
stretching would be the 4 heads that are probably, all part of
okay,
that.
okay. So we'll go with so like, yeah, so that exercise component, I think diet is of critical importance, particularly focus on whole foods diet, minimizing um refined foods, highly refined foods or highly processed foods. I think minimizing stress in your life. Chronic stress seems to be tied to all sorts of bad things at a molecular level. And then sleep. Um, we've all heard the fun stories about how in like it, for every 1 hour of flight time that a fighter jet goes through, it has to go through 10 hours of maintenance time, or I don't know the actual ratio, but it's something where you have to go through the maintenance period. For us as physiologic machines, our maintenance period is sleep. That's when all the systems turn on that repair the body, that keep the body running, that keep it going. And if we minimize sleep or getting low quality sleep, we're just not keeping our, physiologic machine up to operating specs. So with those kind of, like those are the main things that we should focus on: exercise, diet, sleep, and minimizing stress. And I have actually worked with AI to create exercise plans. So kind of have like a personal trainer kind of talk about my overall goals, my overall health, and saying this is what I'm trying to optimize. And worked with and created a personal trainer exercise. It's just for exercise. I named it Steve, by the way. Steve would provide feedback for me and help me get some good insights. I've also had one created one for, helping me to make better diet choices. Um, I haven't done it for sleep or minimizing stress. That haven't hasn't been as much of an urgency for me, but I could see that if you were in an area where you're not getting quality sleep or you're chronically stressed, I could see you creating an AI agent to help guide some of those things. But I would say that that for me has been very valuable to use AI to provide feedback on areas where I can improve and how to be better. And then I know that if my molecular health is taken care of, that that's going to lead to health benefits years down the line, which is going to mean that my healthcare costs 10, 20, 30 years in the future will be lower overall. So it's kind of a, I mean, tongue-in-cheek answer because I don't like it. I don't know how much AI could help us reduce costs in the here and now, but we also need to play the long game. I think AI is a powerful tool for playing the long game.
Okay, so why don't you just ask your brother, who's the doctor, about this stuff instead of AI?
Well, he's not an expert with that kind of things. Our primary care physicians are experts in treating issues in the here and now. I mean, this is going to get criticism of the U.S. healthcare system, but I'm going to stand by it. We're not our clinical providers are not experts in long-term health and long-term health maintenance. They're experts in treating the here and now and getting results in the here and now.
Yeah. See, because I think, you pointed out a good use case of using AI to improve your health. I think at the end of the day, we gotta remind ourselves that AI, it's when if you do something with AI, it's almost equivalent to looking in the library and grabbing a book and seeing what it says. And so, I think no matter what your circumstances are, if you're looking for preventative stuff, if you're worried about something, it can be a reference point to look at or even give you books to look at is something that's, like, not susceptible to hallucinations, though AI is getting a lot better at that, by the way. And depending on which one you're using, it can be better or worse. So, yeah, I, like, hear what you're saying about using it for that. I'm like, yeah, use it for preventative care. I think if you have questions about something, it reminds me of this doctor book I had in my growing up in our house that would basically have these like trees of like, hey, you have this. Does it feel like this? Yes, no, go here. If it feels like this, yes, no, go here. You should call 911 immediately. You should go to the doctor. Or it's probably fine. It's kind of like this diagnosis book written by doctors. I think it's from like the 80s. It's kind of a fun book. I just read through it sometimes. There's some weird, interesting stuff in there. But it's not any different than that, but you're just consulting it through a chat bot where I think people are smart enough to know when an actual emergency is happening. And if they're not, you can always still call 911 when in doubt. But if it's a decision about like where to get care, when, and like these kind of like bigger questions or like a little bit of self-diagnosis, and obviously big caveat there, like be like to be very careful, and preventative care. I think there's a lot of ways that AI can be used for your health and ultimately will save you money because you're spending less on your healthcare. But
Hmm.
do you agree with me, David, or am I just like crazy? To some extent, you agree with the preventative stuff, but you think, yeah, let me hear your thoughts.
That's complex. I don't know if I have a succinct answer.
Do you think people need to be afraid of AI?
I, um, I think we have to quantify or qualify what you mean by afraid.
Well,
I
I
don't
don't
think that
know.
AI is something that I'm afraid of. I think
I
that there
just
are
think,
uses of AI that are terrifying.
yeah, yeah. Well, I mean, specifically when it comes to health, you know, because I mean, what is the difference between going to the library, looking up in a book, versus talking to AI about something?
I think it's the risk of getting information that is um, organized and grouped versus going to primary literature and books. Um,
Okay.
I would really want to
What
see
about the internet
AI.
search versus a book versus
I
AI?
think it's
There's kind of like,
comparable. Like with any of it, I'd really want to see, like especially with like an interactive tool, I would almost want to see it go through some type of clinical trial validation before I start to develop trust in it.
oh, there's some interesting studies that are coming out about that kind of thing,
There are,
actually.
there are, and
But what I hear,
there's possibilities.
I don't know. I've seen people. I don't know. It's pretty popular, in my opinion, especially those who don't really understand AI, to be like, "Oh, AI, you should never use it. You should never trust it." Blah blah blah. Meanwhile, they're like trusting everything they read on the internet, and
Right.
it's
I
like,
read on the
okay,
internet not to trust AI.
exactly. And so part of me gets, I don't know, almost like annoyed when people are like, "Oh, just like dismiss everything AI says or does." It's like, well, no, because there can be value there. And I think, I don't know, because to me, the underlying assumption when you're saying like AI can be, when people are saying, I'm not saying you, but like when people say that like AI can be, oh, careful, it can hallucinate. I don't know, they probably read that somewhere and just love to spout that out. Like it can get things wrong.
Mhm.
Well, sure, it can. Uh, so can the internet. So can people. So can doctors. By the way. Oh, it can. I don't know what some of these other criticisms are, but it's almost like this, like, uh, the pseudo smart thing to do is never like is to criticize AI and never use it. When I'm thinking there's a lot of here's what I
Mm.
was gonna say. There's a lot of benefits to it, and the underlying assumption when some of these gurus and stuff are like talking bad about AI is, to me, that people are dumb. I don't think people are dumb. I think people are smart. I think there might be a few, maybe younger people who have never grown up with anything besides AI, who might fall into categories of like over trust in it or whatever. But I think the majority of us who lived here on Earth for a while prior to AI coming out and being involved with the internet have already a healthy level of skepticism. And we don't have to be so uptight about like, oh, you're just going to blindly follow what the AI says. It's like, no, people are smart. They know to check AI. I think they know to like contrast that with other sources. I think they know to how to interact with the internet in a decently intelligent way. And so for me, I think, yeah, like people are smart. Like, it's worth mentioning not to just trust it blindly and like not to just like listens to its advice. But if you're using it in the right way, you're not seeking it for advice. You're seeking it for
Mhm.
information that helps you understand a
Helps you
topic
make a
more.
decision. I
Yeah,
had someone
ultimately,
explain this concept to me. Generative AI comes up with ideas, apparently. It generates things, and I think the key is, as humans with consciousness, we have the ability to generate our own ideas and conclusions, and we can't rely on AI to be a crutch. But we need to find a way to help generative AI make us more generative in our conclusions and ideas and not just pass all the decision making off onto the generative AI. And that's up to the end user. Are you going to use AI to be less generative or more generative? I think that with what you're saying, if we're using AI in a generative capacity, or sorry, we're using AI to help us be more generative in our decision making and give more information, more streamlined information to us to help us make decisions better, that's a positive. But I would say the caveat is if we rely on it more and more as a crutch, that is a strong negative.
Absolutely. So with that, don't use it as a crutch and use it where you can to help improve your health in whatever way, I think. And I think we'll leave that up to you as the individual, knowing that you are smart enough to know how to make decisions for yourself and understanding some of these caveats. But with that, thanks for tuning in and feel free to subscribe and give us a review, and we'll catch you in the next episode.